Did you know that heart disease is responsible for 1 out of 5 deaths? Buckeye Health Plan is encouraging all Ohioans to take steps to be heart healthy. And joining us today to share expert tips is Dr. Peter Kambelos, a Buckeye Health Plan medical doctor. And Dr. Kambelos, great to see you again.
Always a pleasure to be with you. Thank you.
Absolutely. So heart healthy habits have been a topic of conversation for many years, but why are they especially important right now for Ohioans?
Well, unfortunately, heart disease is the leading cause of death in Ohio, and in fact, nationwide. So it's not unique to Ohio. Ohio ranks 12th in terms of heart disease mortality in the nation, and unfortunately, every year, over 30,000 Ohioans die of heart disease. That's 1.5 times the population of Norwood, for example. And but the good news is on this is that about 80% of premature cases of heart disease and stroke are preventable.
Yeah, there's some sign about it. And a lot of people think that it's mostly happens to older people, but heart challenges can occur at any age. Why is it important to prioritize heart health early on in life?
Well, interestingly enough, 1 out of 20 adults over 20 will have some form of heart disease over the course of their lifetime. That's a pretty significant statistic. And so when we look at what can we do to encourage younger people to be able to reduce their risks, it's several things. Let's start with diet. Diet, for instance, is something we should focus on because there's plenty of room for improvement. Reducing things like rich, greasy, oily, and fried foods, simple carbohydrates, should probably be limited, and the diet should be ideally richer in fruits, vegetables, greens, plenty of water, plenty of fiber, and limiting some of those things that could be harmful. Exercise. Let's talk about that a little bit. A lot of young people, and adults actually, spend a lot more time in front of their cell phone on their keyboard than they do exercising, right?
Yeah.
So, 30 to 40 minutes of regular exercise, 3 to 4 times a week, most days of the week, is a good habit to get into early in life. The earlier we get into these habits, the better that the likelihood that we will maintain them later into our adult life. Also, let's cut out smoking, or better yet, don't start.
And alcohol, probably.
And alcohol,
yeah.
Cutting back on or limiting alcohol consumption. And then 2, let's get into the habit at an early age of getting our regular checkups. That's a stretch for a lot of younger people, but it's ever so important. Younger folks should really focus on periodically getting a physical exam, but with their primary care doctor, getting their cholesterol levels checked, getting their blood sugar levels checked, and getting their blood pressure checked as well.
At least once a year, right?
At least.
At least once a
yes.
year. So we know that poor heart health can lead to heart attacks. Are there some signs that you may be about to have a heart emergency?
Sure. There are lots of potential signs and symptoms, some of which can overlap with or be confused with other medical problems. So really anything that we're going to talk about here should probably be brought to the attention of the doctor to further evaluate it. But let's get into some of the more common signs and symptoms. It's not just chest pain or pressure or tightness. There are some others we'll get into, but tightness, heaviness, pressure on the chest, an elephant sitting on the chest, numbness or tingling in the chest, the neck, the jaw, the teeth, the extremities. Breaking into a cold sweat, is something we see fairly commonly. Difficulty breathing, shortness of breath, sudden weight gain could be a sign of heart disease, swelling of the feet or ankles, and in some, populations, we look for some more what we call atypical signs and symptoms, like in the elderly, diabetics, and women. Could be nausea, could be an upset stomach, stomach discomfort, lightheadedness or dizziness, or just something as simple as unusual fatigue. The bottom line is, all these symptoms should be brought to the attention of your doctor for further evaluation.
And I've heard particularly in women, shoulder pain or shoulder aches?
It could be, and I'll give you a good example of something that was very atypical early on in my career, and I'll never forget it. It was about 25, 26 years ago. I had an older woman come to see me in the office for what she thought was a sinus headache. risk. And upon further probing and investigation and discussion, we came to determine that it was anything but a sinus headache. In fact, she was having a heart attack right then and there. So shortly after that, she ended up with heart bypass surgery. So it really takes, the clinicians being very acutely aware of some of these atypical signs and symptoms and to probe a little bit further, because those do show up all too often.
So Dr. Kambelos, what makes someone more at risk for heart challenges?
There are risk factors that we can change, and there are those we cannot. We can't change our family history, obviously, but some of the things we can change, we've already touched on some of these: diet, exercise, alcohol and smoking cessation. But let's look at diabetes, for instance. Getting and keeping, our diabetes under control with an A1C of below 7% or better, very important to reducing risk. Getting and keeping our blood pressure numbers below 130 over 80, and getting our cholesterol numbers to goal. And those numbers should be discussed with your doctor. Depending on your personal situation, you may have different goal numbers. And again, following doctor's advice. Your doctor's there to give you good, healthy advice. And it's a good idea to have good, close discussions with your doctor and ask questions when you don't understand.
Absolutely. How does Buckeye Health Plan help its members take care of themselves?
Our motto is that we lead with heart, and we are transforming the health of the community one person at a time. We sincerely care about our members, and it shows in how we surround them with the care and support services they need to travel along their health journey. We have care and case managers that can provide them with important healthy living tips and also help coordinate their care. Our members are forefront in our minds. We can help them identify and make an appointment with a primary care physician if they don't have one. We will get them to and from that appointment at no charge to them. We also, at no cost, cover preventive health care services. We also give our members the opportunity to earn healthy rewards dollars for completing important primary care services, preventive care services, that they can then apply in turn to rent, gas, and healthy groceries.
Oh, so many services, and we are so lucky to have Buckeye Health Plan in this community. Dr. Kambelos, thanks so much for joining us. And for more information and heart health tips, all you have to do is visit BuckeyeHealthPlan.com/heart.